Hi, and thanks for having me here. I'm Barb Lee. I direct the National Children's Center for Rural and Agricultural Health and Safety. And what I'm going to share with you from the historical perspective very much parallels what Sherry shared with you in terms of Maryland's story. So when I got involved in this, I might have to find the clicker. We were in the midst of kind of the very beginning of looking at children as a unique population that needed to be looked at from a different perspective than the agricultural workers. And there were a lot of questions that were being raised about what is the role of the government in terms of what children should be doing versus parents. We knew that at least 95% of the kids who were involved in agriculture were on family farms. And what was the role of we talk about the 3 E's of engineering, education, and enforcement in terms of injury prevention. And then looking at what is the culture of safety, what are the expectations of the farming community in terms of the risks that they're willing to take. And then what should be our common vision of what can we be doing with this. The Surgeon General's Conference that Brad talked about addressed adults working in agriculture. And we were asking the question, but what about the kids, whether they're working or not working, and who's responsible for that? We started asking the question, is this a USDA issue? And they were like, well, we're talking about production agriculture and the adults who are producing the food. We asked, is this a maternal child health bureau issue because they deal with children and children's welfare? And they were, well, but it only counts if they're not working. And then we said, is it a NIOSH issue? And they said, well, we can do research if it's children, but it's really not our issue either. So there were a lot of questions. Oh, well, then where do we go? Like who's really looking at this issue and getting the whole picture and putting it together? So we asked the question, who can help us? and we really didn't know. There were Marilyn was doing her thing, and there were other people asking these questions, and we thought, we really don't have a body of knowledge. We don't have the whole picture put together. So what we did was we received funding from the Kellogg Foundation and a few other business groups to put together a consensus development group that looked at what's the big picture. And we broke out people into 9 different groups from the parents' perspective, from the educator's perspective, from the rural sociologist's perspective, the ag media, the policymaker, and the pediatricians, and many of the people here were part of that group. And really over the 3 days, talked about what are all the issues, tried to cluster them, and then went out to the farms and talked to the farm parents. Is this the way we're seeing it? Is this accurate or not? And so that was really the first time that all of this information was put together. But we really didn't have any recommendations that came out of that. We said, this is the problem. These are all the problems, and sort of categorize them that way. So from there, it was thought, well, then let's start to pull this together and let's have a plan. And there was a group of 42 people. We formed together and called ourselves the National Committee for Childhood Agricultural Injury Prevention. And over the course of about 12 months, really started to pull out, well, what do we know? What don't we know? How can we set a common vision? And thinking back to that time, it's interesting because we really did believe that there were about 350 kids who were killed every year on farms. The numbers of non-fatal injuries were estimated at 300,000. So we thought that's how big the problem is, and most of these kids are working and really didn't have a good sense of what the real picture was out there. So one of the first recommendations that came out of this was that we should have one federal agency that takes the lead and is responsible. We should have some good surveillance data so we get a better sense of what the numbers are. We should look at what's the role of public policy and regulations, where do they work and where don't they work. And then just following through in terms of education and some of the outreach. And the process was very interesting because we had people sort of vying for priorities within that, and some people really fighting with each other over what's the role of regulations. And when we came through all of this and had the document ready, we felt we had to get some consensus from the outside world too. And there were actually 88 different organizations that signed on to this that said we support this in principle, maybe not every recommendation that went through that. So we took that document that had the signatures of these organizations and then took it to the U.S. Congress. And actually it was Senator Harkin who first endorsed this as the first national action plan, and then Congressman Dave Obey who facilitated the provision of funds specific to NIOSH, which then said we will be the lead agency if you give us the money. Brad was there, you remember that? And so it was really that process then of getting federal appropriations specific to children and agriculture and running that whole process through the leadership of NIOSH that launched the first common written documented plan for the country. We knew one of the shortcomings of the plan was we did not look at the special issues of the migrant and seasonal workforce, of the kids who are hired to work in that area, and so it was a different group of people that got together and came up with that plan, some of the folks that are part of the steering committee here. And then felt that after 5 years, we thought we'd probably have all our problems solved and we should just take a look at it and see if the plan was on track and if we accomplished everything. And 5 years seemed at that time like we should have gotten a lot done, but we realized that we had a new picture of what's going on. We had some now new priorities. What we learned in the first 5 years was the data showed us that it wasn't so much the kids who are working, but much more so the kids who are not working who are at greatest risk of injury, and that some education programs worked and some education programs didn't work, and that regulations were really a very limited option of getting some change. And meanwhile, while all this was going on, the world for children in general was getting safer. So we had a decline in injuries, a decline in deaths, and much safer expectations for children in general in terms of just look at car seats and bicycle helmets, things like that. So things were changing, but at the same time, we knew that every one of those injuries was predictable and preventable. So the team put this together and felt that they had redirected some of the priorities. And about a decade later then, we used a different process and had a smaller group then that went back and assessed what's been accomplished from the last plan, what has not been accomplished, where are we now, and how do we redirect this vision of what needs to be done for the future based on the new data, the new roles of children in agriculture, some of the positives and negatives in terms of regulations and their effect on that, and then really the whole role of the private sector and many of the new organizations that were jumping in on this. So throughout this whole process, we had not only plans, but we had many more people getting involved in groups like the Childhood Agricultural Safety Network. That's a loose-knit coalition of people that get together at least once a year, and then by phone just to talk about who's doing what. So we have that group. We have many private industry groups that are sponsoring and funding some of this work, and we have a lot more people that just in general have a better understanding of what the scope of the problem is. So this is where we are now. We've come a long way. We have a plan, and the 2012 action plan is in your packet there, and we'll be talking a little bit more about that and specifically what that says for us.